As part of the shift from a criminal justice-based approach to a public health and human rights-based approach, the National Collaborative has, over the last 2 or 3 years, been engaged in developing a Charter of Rights for people affected by substance use. The Charter, now launched, has won broad support within the alcohol and drug sector from the First Minister of the Scottish Government and from the United Nations, which is now promoting it as the first of its kind in the world. So as chair of the National Collaborative, my call to action is now for the implementation of the Charter. And we all have a part to play in this. First and foremost, those people affected by substance use and their advocacy bodies need to use it on an everyday basis throughout the country to ensure they get the sort of services that they need and are entitled to. It has to be used by the Scottish Government and embedded in its new strategic plan on alcohol and drugs, and to be embedded in the national specifications for the delivery of local services, as well as in the partnership delivery framework between the Scottish Government and local authorities. And it also has to be implemented by the scrutiny bodies to ensure that the delivery of human rights-based services aligned with the Charter are monitored. And already we see that there is emerging practice, and the Charter and its toolkit, including the FAIR model, is showing the way forward in how to use the Charter. The key priority is to ensure that lived and living experienced groups around the country are meaningfully involved in the design, delivery, and monitoring of human rights-based support services for people affected by substance use. And then finally and critically, to fulfill the potential of the Charter and to be the best guarantee of progress being made in all of this is through the introduction of the promised Scottish Human Rights Bill. Among other things, this bill will introduce into our national law the internationally recognised right to the highest attainable standard of physical and mental health, a right to be enjoyed equally by everyone, including those people affected by substance use. So let's all work together to implement the Charter, to fulfil its potential and help improve and save lives.